Mark Busench again for City Limits, and to my left, Ronnie Kauder. Kauder, you see that good thing I asked you in the beginning, Ronnie. But she is the Senior Research Director here for the New York City Labor Market Information Service. Ronnie, welcome. Ronnie, we're here to ask you today about the recent report that the Institute just released, the health information field. What is the health information field?
Well, the health information,
hold on to that,
sure, thank you. The health information field is a couple of different things. It's, everybody knows that electronic health records have grown, and hospitals and the doctors and health systems are using them. So the health information is a couple of different things. It's IT in healthcare, which are basically your basic IT people, web developers and programmers, software developers, and people who help desk people and network administrators. So there's an IT part to healthcare. But what we focused on even more was the people who actually manage the information that's generated in the course of providing healthcare, meaning the person who gathers the information from you at the beginning and puts the information into the electronic health record system, the people who code that information for billing purposes, the people who manage the whole flow of the information, and then also the people who analyze that information to find out if there are any trends, both from a public health point of view and also from a particular healthcare institution point of view. So that's what we did, and everybody was interested in careers in health information, but there was a lot of confusion about what it was. So I think we helped to clarify that it's a couple of different things. We have a website, which is www.gc.cuny.edu/LMIS for Labor Market Information Service, and it's right online. I should also say that one of the other things we do is we track how many actual advertisements there are for these kinds of jobs. And I was just saying, I just pulled it up this morning, and you can see that over the last 4 years, the trend is upward
for these jobs in that field. In
the health information management field. So we profiled it because it's promising, it's changing, there's demand for it, and we just wanted to help people figure out what they needed to do. And I guess the other thing we looked at was who would be happy in this kind of work. And I think there was agreement that you have to be detail-oriented, you have to like information and analyzing things, and you have to like computers and not mind being at a computer a fair amount of the day. So it's for people who are detail-oriented and interested in this environment and maybe interested in healthcare, but maybe not hands-on with patients. Somebody who wants to be on more of the the administrative side.
Right, because that's interesting, because someone might say health information field, oh boy, that means I have to work in a hospital setting, but there's obvious difference between healthcare and health information.
Right. You might work in a hospital or, anywhere else, or in a doctor's office or a community health center, but you're not going to typically touch patients. You're going to be in the field, but you'll be on the information side of the field.